A very good evening to everyone. As we kick off this enlightening live session, my name is Jigna Jain and I am proud to serve as medical writer at Connecto Clinic. Today, we are here to explore the horizon of medical knowledge and practice, propelled by a powerful platform of Connecto Clinic. As a practice management solution for clinics and hospitals, we strive to empower healthcare profession with cutting-edge tools and resources that redefine patient care and elevate medical practice to new heights. One of the remarkable feature of Connecto Clinic that we particularly thrilled about is Med Updates. It is a space where a dedicated medical team curates and shares the latest article driven by thorough research and encompassing a diverse range of specialties. In a world driven by rapid advancement, staying up to date with latest in medicine it's not just a necessity, but a commitment to provide a best possible care to our patients. And today, it's an absolute privilege to extend a warm welcome to a distinguished personality who has made significant strides in the field of medicine, Dr. Sonali Gupta. Dr. Gupta's accomplishments are as inspiring as they are impressive. She holds a MBBS degree and MS in obstetrics and gynecology from SMS Jaipur, along with FAMS from AIMS and FICS from Singapore. Her pursuits of excellence even lead to an advanced degree in diploma in reproductive endocrinology from Germany. She served as a medical director and lead consultant at the Bliss IVF and Gyna Care in Greater Noida, further solidifying her commitment to women's health. Additionally, she holds the position of additional director at Fortis Hospital in Greater Noida, where her expertise continues to impact countless lives. She was the head of the Department of Obstetrics and Gynecology at Max Multispecialty Hospital in Greater Noida. She was also UP State Secretary at Doctor Wing in 2022, showcasing her contribution to women health advocacy. Furthermore, her role as a treasurer in Greater Noida Obstetrics and Gynecology Society, her tenure as a former chief editor in the Greater Noida OBG Society, and her involvement in the ex-scientific secretary at Delhi ISR in 2017 truly demonstrate her multifaceted involvement in medical community. Dr. Sonali Gupta expertise is not confined to a medical arena alone. She plays a pivotal role in social events and academic activities, bridging the gap between healthcare and community engagement. Once again, it's an absolute privilege to have Dr. Sonali Gupta with us. Her presence adds an invaluable layer of insights to our webinar, and we are honored to share her knowledge and experiences with her. Over to Dr. Sonali Gupta, ma'am.
Hello, Jigna, and a
Hi,
warm
ma'am.
welcome to all my gynecologists and my fellow colleagues over here. It's an immense pleasure and privilege to be here amongst you all, and especially on the topic which is very close to my heart, that is in IVF. And today we'll be discussing something about the latest advancement in IVF. Uh, as we all know that IVF has become very a boom in the life of people who are not able to conceive by the natural means, and it is a blessing and it's a real miracle that those childless couples, through the advancements, through technology, can still have their baby, their own genetic baby, through the technology called in vitro fertilizations. And as we know that the females are becoming more progressive, more ambitious, and we are moving towards a more technologically advanced world, somewhere the infertility is on a riser trend. So, the IVF or in vitro fertilization technologies and treatments are also evolving very rapidly. There was a time when we started our treatment way back in 2000 that so many injections we had to give to the patients. Patients really used to have very painful when the retrieval of oocyte was done through abdominal route or through the advent of like hysteroscopy, transvaginal ultrasonography, and with the antagonist protocol. Definitely, the life of the clinician as well as the patient has become very comfortable. Those who are going for IVF treatment. Yes, secondly, somewhere down the line, since this branch is so evolving, there is a recent trends which keep changing and keep occurring. Vikram, can you change the slide? I'm not able to do that. Right. So today, as we know that the reproductive medicine is staying informed about the latest breakthrough in essential, the world is constantly evolving with the researchers, practitioners continuously. We are striving not only to enhance our success rates, minimizing risk, refining the overall experience of the patient is also very important. So keeping pace with all these advancements, the healthcare providers offer the patient the most effective and cutting edge of their treatment available. As the today's topic is on the recent and the latest advancement, I would be covering few topics which are there like pre-implantation genetic testing, time-lapse, imagining an incubation system, artificial intelligence, which is there everywhere in this world nowadays. With the advent of chat GPT, we are so much into the war, but infertility treatment is not out of it. Artificial intelligence has also come into the IVF treatment, in vitro maturations of oocyte, single embryo transfer and phasal techniques, and last but not the least, like oocyte preservation and cryopreservation technology. As we move ahead with the first topic of our latest advancement is the pre-implantation genetic testing. What actually pre-implantation genetic testing means that before implanting and transferring the embryo, we take few cells out of the embryo and check them for the genetic disorders. This is the latest technique which gives so much relief to the patient, especially those who are having recurrent chances of abortions, that they are conceiving through IVF also, but they are not able to carry their pregnancy till term, either because of some genetic disorders, some aneuploidy, or maybe some inheritable disorders which are already there, which they don't want to transmit to the next generation. So, by this technology, what we can do, we can pre-test those embryos when they're in the blastocyst stage, and after going through the genetic analysis and testing them and finding them to be transferably fit, then only those embryos are transferred to the couples, females' wombs. So, by screening embryos for chromosome anomalies, some of the tragic situations can be avoided. And this is something very, very helpful to those who are facing recurrent abortions because of some genetic defect in the babies. And this can provide some disaster like miscarriage, and also it is a very helpful for those couples who are already having a known inheritable disease, जिनकी जेनेटिक्स में ऑलरेडी कोई इनहेरिटेबल डिजीज है, उनके उस एम्ब्रियो में वो अगर वो जेनेटिक प्रॉब्लम नहीं है, तो we can select those embryos and transfer them. Last but not the least, as we have said that we have become so ambitious and we have become so very busy in our own professional life. So when we plan pregnancy in later half of your life, that time also when the chances of having a malformed baby are higher. So we can just select the correct embryo to be transferred and implanted so that the chances of miscarriages and inheriting a genetic defect will be minimized. There's a real life example I can share with a non-consanguineous couple. The wife was 35 and the husband was 39 years of age. They had a recurrent miscarriage and they were referred for genetic counseling. The couple has suffered 2 times first trimester abortions. When we talk about the first trimester abortion, means chances of any uterine malformation is partially ruled out. But anyways, we did a hysteroscopy also and there was no genetically and the structural defect in the uterine abnormality was not seen. Those 2 embryos from the couple were gone for a pre-genetic testing after the blastocyst formation or day 6 after fertilization. So once we have transferred those embryos and the couple conceived successfully and she underwent a cesarean section for different medical conditions, but definitely they got a very healthy baby even after having gone through 2 miscarriages after IVF. So this is something which is a blessing for couple who had a very painful history of abortions. They can go for a pre-genetic testing to select the correct embryos. Now, one more thing which we'll talk about, the second advancement is a time-lapse imaging in the incubation system. Jimmy, can we reduce the background music, please? Can we reduce the volume of background music? Is it there with you? Right. So when we are talking about the time-lapse imaging and incubation system, what is that? जैसे कि हम लोग अपने इंक्यूबेटर के अंदर ही हमने कैमरा फिट कर दिया, Earlier, what used to happen, we used to take out the embryos and check under the our stereosome microscope to know about the how the embryos are growing, which embryo is spacing up, which is good, which is not good embryo. But with the advent of the time-lapse imaging and the incubation system itself, we need not to take out the embryos to check their viability, their growth, their pacing up, their quality. Everything is recorded in the real time in the incubation only. So this has given a very advantages that the embryos need not to be taken out of their ecosystem. We don't have to take them out from the incubation to check whether they are doing well or not, which one is doing well. Sometimes so place initially going in a slow pace embryo they catch up, they might not be the right embryos to be transferred. So which embryo to be transferred, which is doing good, you have to either you have to frequently take out the embryo and check it out, which is not advantages, which is not recommended. And second option is the basic thing is going for a time lapse imaging technique. So this time lapse imagining this system, as we compare with the conventional or traditional, has definitely give us a better live birth rate and the implantation of the pregnancy. We can select the correct embryo, and we also get a clinical pregnancy rate also in a higher tune. The chances of miscarriages and abortions are also lower in cases of time lapse systems. So it is clearly seen that this system, when it came like a big breakthrough, but due course of time, there were some discrepancies and some controversies were going on as how effective is this time lapse incubation because of the cost factor. But now what happens? Then comes the artificial intelligence into our life, which has changed everybody's life. So in IVF also artificial intelligence has taken a big step that incorporating the time lapse incubator with artificial intelligence. Through artificial intelligence, we have trained our robots for thousands and lakhs of embryos. They have studied them and they have seen their behavior and nature so they can select which is the right embryo to be transferred. They're getting the feedback from the time lapse incubators and the systems. So, in analyzing those embryos, they can give us a right embryo to be transferred. Not only embryos, the artificial intelligence has also entered into the domain of our sperms. So when we are going for a morphokinetically human sperms are being selected, their chances of getting a better sperm, more viable sperm, which can give us a productive fertility are higher. And as long as now there are the advances in which the artificial intelligence are also coming into the role of this endometrium thickness also, where so many studies are going on, we can select which is the right window for the transfer of the embryo so that the implantation should take place. So artificial intelligence not only enters as sperm selection, the embryo selection, and also it is coming into the endometrium thickness and lining and categorically selecting which is the right time for embryo transfer. Furthermore, the artificial intelligence is also making our clinicians' workload reduced by giving us the protocols by the novel markers that predict the pregnancy and live birth rate. Interestingly, the artificial intelligence, the data mining exists as a database led to the identification of novel genes associated with the endometriosis. So this is also coming into in the scene of this IVF also. So artificial intelligence enhances the embryo selection based on the morphokinetics, the sperm selection, the endometrium thickness, as well as for the novel protocols also it is helping the clinicians. So there was a study which were five senior embryologists have done for the electronic questionnaires, and now they have really come up with that this morphological electronic morphological assessment through the artificial intelligence for the till blastocyst formation is there, means day 6 embryos are there from the time of retrieval of oocyte. They're giving it a better selection, better success rates, better pregnancy rate, and better baby home carrying rate, having lesser chances of miscarriages, lesser complications to the patients, and minimum intervention is required. Now coming with the world of in vitro maturation. What is this in vitro maturation? If we'll talk about, in vitro maturation is a technique where somehow you try to understand that in a why we are so scared of stimulation and giving so much of injections. Whenever we talk to any patient for infertility treatment or IVF, the first question comes from them, इतना सारा इंजेक्शन मैडम पेट पे लगेगा, मुझे दर्द होता है, मुझे डर लगता है. So as I've already told that the treatment of infertility is evolving, we are trying to make how we can increase our success rates. Vis-a-vis, we are also doing work how we can really make it more feasible, more comfortable, more compliant for the patients with minimum intervention and minimum injections and pain to them. Though now the patients have protocols have come where we give very minimum stimulation. But if somebody even doesn't want that stimulation, we have got an answer to that also. द आंसर इज इन विट्रो मैचुरेशन. क्या होता है जब हम अंडे को बनाते हैं, नॉर्मली हम लोग एग को मेच्योर करने के लिए 10 से 12 दिन का इंजेक्शन लगाते हैं, राइट? तो किसी किसी में जैसे कि पीसीओएस वाले पेशेंट में देयर हाई चांसेस ऑफ ओवर स्टिमुलेशन, या तो अंडा बनता ही नहीं है या फिर बहुत सारे अंडे बन जाते हैं, which leads to the this is the only life threatening situation which is there in cases of infertility because of iatrogenic hyperstimulation. जब बहुत सारे अंडे बन जाते हैं तो उसमें कहीं ना कहीं पर वैस्कुलर परमेबिलिटी प्रॉब्लम करता है, एसाइटिस हो जाता है, पेट में पानी पड़ जाता है, लंग्स में आ जाता है. वेरी रेयरली इट इज अ कॉज ऑफ इवन द मोर्टालिटी कैन हैपन, बट वी डोंट वांट एनी मॉर्बिडिटी और मोर्टालिटी. तो व्हाट कैन बी डन, वी रिट्रीव द इमेच्योर सेल्स आउट ऑफ द एग, आउट ऑफ द ओवरीज. हमको उनको इंजेक्शन भी नहीं देने का मन है तो मत लो इंजेक्शन. जो एंट्रल फॉलिकल्स आपकी ओवरी में पहले से रिक्रूट हो जाते हैं, या बहुत मिनिमम स्टिमुलेशन देके, आप ऐसा समझिए जैसे खेती में आजकल कच्चा आम निकाल लिया जाता है और कच्चे आम को आर्टिफिशियली पकाया जाता है. आई एम जस्ट टॉकिंग इन अ लेमैन लैंग्वेज कि वी जस्ट रिट्रीव दोस लेस मैच्योर फॉलिकल्स and then and in the artificial in our laboratory through medias, different culture medias, we take them to maturity level of mitotic division 2. M2 फेज में उनको हम लेके जाते हैं जहाँ पे कि वो फर्टिलाइजेबल फॉर्म में प्रेजेंट कर जाते हैं. तो the questions and the intent of giving so many injections to make a get a mature M2 phase oocyte is now coming less. Even if we get a G1 stage, M1 stage or GV stage, those follicles can also be matured in the artificial media so that they can become a viable for getting fertilization and giving us a baby. So this help. The advantages of this in vitro means outside the body. Maturation has already been understood. या उनको पकाते हैं हम लोग, mature अंडा लेके आते हैं. So this avoids the side effect of gonadotropins administration. जो injections हम लोग FSH, HMG के लगाते हैं, उनका कॉस्ट बच जाता है, उनके इंजेक्शन के साइड इफेक्ट बच जाते हैं. इट इज ऑल्टरनेटिव अप्रोच डेफिनेटली, but there are some criteria by which should be fulfilled. Not everybody can be taken for this. The younger age group females can go for it, which have a good enteral follicle count. This is less costly and safer alternative to IVF in younger women with natural normal menstrual cycles. This can also be used for the with a female with poor response. Some females, though they have good follicle count, but their response is not good. No matter how much stimulation we give, their follicle does not mature. So what we can do, we can retrieve those follicles also and get them mature in a laboratory setup with some special medias. That media contains a cocktail, and different medias are being understudied. Though the differences and the outcome of different media is yet not established. Whatever Cooper's का आता है, Origio का आता है, और आप even आप कस्टमाइज होममेड मीडियाज को भी यूज करके स्टडी किया गया है, and the results and the response is almost equivalent. So this is how we can really cut down the cost of our IVF treatment. We can make it more safe. We can make it less painful. We can make it more patient friendly. So this is the inclusions patients, like if previously also they have failure cycles or the fertility, especially this can be used for the young patient जिनमें की हार्मोन सेंसिटिव ट्यूमर होता है. मीन्स ऐसे कोई यंग पेशेंट्स है जिनमें कि हम हार्मोन के इंजेक्शन दे ही नहीं सकते, अगर हम देंगे तो उनका कैंसर को बढ़ने का चांस है. तो उनके ओवरी में जैसे भी कच्चे अंडे होते हैं, कच्चे फॉलिकल्स होते हैं, मेच्योर है इमेच्योर है, व्हाटएवर क्रॉप वी गेट, वी जस्ट टेक इट आउट, वी रिट्रीव दोस फॉलिकल्स, we give the chemotherapy, radiotherapy, whatever is needed to cure them, and once they are cured, we just make them mature, fertilize them, make embryos, freeze them, and once they have gone free from the cancer treatment, we can transfer those embryos into their womb and make them their own genetic babies. This is how the science is evolving. And especially one more thing, where the male factor in fertility is there, the female is not at fault. The male factor is problematic for the fertilization. इन दोज केसेस ऑल्सो जो भी क्रॉप हमको एग्स की मिलती है हम रिट्रीव कर लेंगे विदाउट स्टिमुलेटिंग द फीमेल because female factors are almost normal. Let the female have their own natural cycle follicles which are coming. वो जो भी मेच्योर हो रहे हैं जो इमेच्योर हम सबको रिट्रीव कर लेंगे उनमें मेल फैक्टर्स एक सी करके एम्ब्रियोज बना के ट्रांसफर कर देंगे. So female will not have the brunt of having a male factor infertility. She will not has to face those painful injections. Any painful injection if she is not willing. Still we can give them their own genetic baby. Definitely, the in vitro maturation of oocyte procedure has a bit lesser success rates because when we retrieve a mature oocytes, we have already done everything inside. So those are a bit on a higher tone, but definitely, as we know, science is evolving. We might get more better culture media to for the maturation of those immature oocytes which have been procured. There's a real life success story which I want to share with you. There was a patient X who's this is a fictitious name. So 34-year-old female with a husband, they married for 5 years and desperate to start their family. And they visited to one of the fertility clinic. She had a blocked fallopian tube, polycystic ovarian syndrome, whereas the husband has a cryptospermic. The husband factor was not good. So what was done? The in vitro maturation was done. The whatever oocyte was there, they were retrieved, they were matured in laboratory. With the husband sample, TISA was done from the testicular sperm aspiration. TISA was done, and with those sperms only the XC was done. And then we freeze all the embryos, and then those embryos were transferred, and this couple got a very healthy 2.5 to 2.8 kg twins. This is what reward patient get by this technology. So, when we have talked about the in vitro maturation, now we know that science is evolving, our laboratory is becoming more refined. So are our couples also. Now, patients are coming with more awareness. They don't want to face the problems and challenges of multi-fetal gestation. As everybody knows, जिसको भी बोलते हैं आईवीएफ कराने का मतलब उनको लगता है कि ट्विंस या ट्रिपलेट होंगे. स्पेशली सेलिब्रिटीज लाइक फराह खान एंड ऑल दोज हैव मेड वेरी पॉपुलर कि आईवीएफ कराया था तो ट्रिपलेट हो गया, बट इट इज नॉट द केस. थ्रू आईवीएफ also we are now going towards the giving a single child to the couples through the single embryo transfer after effective freeze all cycles. So what is happening when there is a blastocyst or cleavage stage is there of the embryo, मतलब जब embryo day 3 या day 5 होता है हम उसको freeze कर लेते हैं and then we prepare the lining again and we transfer only single embryo, only one embryo which is the best one. How we have selected this embryo, we might have used that AI, we might have used that time-lapse technique or by other different methods, and we have used that blastocyst is the best to give us result. And definitely we have optimized our lining also after going through freeze or technique. So जब हमने पहले पूरा फ्रीज कर लिया, नेक्स्ट टाइम में हमने सीक्वेंशियल मैनर में सिर्फ लाइनिंग को प्रिपेयर किया. अच्छा लाइनिंग बना के बढ़िया अंडा ला के हम सिंगल एम्ब्रियो पे ट्रांसफर करेंगे. वी आर डेयरिंग एनफ टू गेट अ रिजल्ट आउट ऑफ इट. So this is how it is benefiting the couples. It is significantly reducing the risk of multiple gestation. लोगों को नहीं चाहिए ट्विंस आजकल, नहीं चाहिए जुड़वा बच्चे. गॉन आर द डेज एक के साथ एक फ्री वाला टाइम हुआ करता था. When I started my practice, everybody used to come and say, मैडम हमको तो जुड़वा चाहिए, 3 हो गए तो वो भी चलेंगे. और कभी कभी किसी किसी के 3 में से एक बच्चा अगर ऑटोमेटिकली मिस्ड हो जाता था तो उनका मुंह बन जाता था, मैडम मेरा तो नुकसान हो गया. Yes, I have lost 1/3 of my property. But those are the past stories. Now people are really going for a quality of life. They just want to raise a single baby one time. So for those couples, especially, we have got to offer them a single embryo transfer. We are very rampantly doing in our laboratory the single embryo transfer over here because sometimes people are coming with a secondary infertility. जिनके पास ऑलरेडी एक बच्चा है, उनको अब सेकंड बेबी चाहिए. अब सेकंड बेबी में जुड़वा हो जाएंगे तो दे आर नॉट रेडी फॉर 3 बच्चा. तो दे आर वेरी कस्टमाइज्ड. हमको एक ही बच्चा चाहिए एंड दैट्स व्हाट वी आर कम टू यू. So for them also we are giving single embryo transfer. Definitely counseling, preparation, lining, embryo selection, and the laboratory situation and optimization plays a very important role. So is the confidence and the daring of the clinician also. Like I do clearly counsel my patient. देख लो भी 2 डलवा लो, अगर 2 हो गए तो ठीक है, नहीं तो एक भी हो जाएगा. Not every couple get twins. There are only 30% chances of getting twins in IVF, even if we transfer 2 baby. But still, those who are very adamant to get a single baby, we just transfer single embryo only. I prefer transferring blastocyst, which is a day 5 embryo, where the chances of success rates are better. So this by this there are few things also advantage that they get the multifetal gestation नहीं होते हैं, singleton pregnancy होती है, कहीं ना कहीं chances of abortions भी कम हो जाते हैं. So this the results of improved pregnancy rates in the single embryo transfer has already been seen, and especially in country like Japan and all those things which are now going for a natural cycle IVF. वो कुछ स्टिमुलेशन देती ही नहीं है. वो एक ही अंडा निकालती है, दो अंडा जो बनता है फीमेल्स का उन्हीं को प्रोक्योर करती है, उन्हीं का बच्चा बनाती है और एक ही एम्ब्रियो ट्रांसफर कर देती है, बिकॉज देयर द कॉस्ट इज नॉट अ फैक्टर. बस इन अ पुअर कंट्री लाइक इंडिया वेयर एवरीथिंग इज कॉस्ट डिपेंडेंट, we want more, dil mange more, we want more eggs, we want more embryos, we want more babies. So when we started our practice, that was a trend, but nowadays for last few years I am finding people coming to me for a single embryo and single baby only. So for those, we have got an answer to a single embryo transfer after going for freeze-all and then selectively preparing the lining and giving a single embryo, so that the success rates are way tuned the higher and chances of miscarriage is also less. So now comes the benefits of freeze-all. As I've already told you, there is a window period of endometrium becoming receptive. So especially in patients like PCOS, where the chances of ovarian hyperstimulation is high, the patients are already having so much of bloating and they're having fluid in their abdomen and sometimes in their pleural cavity also. So we don't transfer the embryo that time. We prefer going for a sequential IVF. What sequential IVF means? अंडा निकाला, बच्चा बनाया, फ्रिज में रख दिया. आई नॉर्मली टेल माय पेशेंट, जैसे आप छोला भटूरा बनाते हो, छोला को बनाया और आपने उसको फ्रिज में रख दिया, देन गुड प्रिपरेशंस फॉर भटूरास, एंड व्हेन द right time come, then only you make a bhaturas and then take out your cholas also. You don't take both the challenges simultaneously. So is in a IVF also, we just prepare the good embryos, freeze them out, and then we prepare a lining separately and take out the embryos depending upon the patient choice. If we want two embryos, we thaw two blastocysts, or if we want single embryo, we thaw one blastocyst and just transfer the one embryo into it. How it is benefiting us? It is giving the patient a relief for some time, as long as they get a period and their all the hyperstimulation sites are wean off. Then secondly, they definitely increases the success rates, because the endometrium is unnecessarily exposed to supraphysiological level of gonadotropins. When we are stimulating for oocyte retrieval, हमने अंडा बनाने के हमको इतने इंजेक्शंस लगाए हैं कि एंडोमेट्रियम भी अननेसेसरली सुप्राफिजियोलॉजिकल लेवल पे स्टिमुलेट हो जाती है, वो भी सेटल हो जाएगी. हमने जब अंडा निकाल के उसको फ्रीज कर लिया, देन वी आर जस्ट फोकसिंग ऑन द लाइनिंग, we are not focusing on the oocyte that time. And nowadays I have really changed my practice of going for a natural cycle frozen embryo transfer. What we do in natural cycle frozen embryo transfer, again in the next cycle we just have minimal stimulation so that we can get one egg or two egg like in natural cycle, so that we folliculogenesis करते हैं, उसको मैच्योर करते हैं, और जब वो अंडा रप्चर होता है हम अपना फ्रोजन एम्ब्रियो ट्रांसफर कर देते हैं. The egg which is ruptured in this cycle will give me support in the luteal phase. एम्ब्रियो लगने के बाद में, प्रेगनेंसी होने के बाद में जो हार्मोन का सपोर्ट चाहिए होगा, वो मुझे ये वाला अंडा कर देगा जो मैंने फ्रोजन एम्ब्रियो ट्रांसफर के समय प्रिपेयर किया. So this is a combination of natural cycle frozen embryo transfer, which is really giving me very good results as far as the compliance is concerned. And more importantly, the happiness thing is, post embryo transfer, patient ki life is very much similar to the natural conception. Now we are trying to bring the IVF cycles as close to as natural conception. पेशेंट को बच्चा लगने के बाद वो अननेसेसरी के एक्सपोजर ऑफ हार्मोनल इंजेक्शंस, वो रेस्ट, वो माइंड ब्लॉक, वो सबसे हटाने के लिए हमको उसको नेचुरल साइकिल फ्रोजन एम्ब्रियो ट्रांसफर इज रियली गिविंग मी वेरी गुड रिलीफ. So freezing our policy is becoming very in nowadays. It's my favorite. Now coming one more topic, which is the ovarian tissue cryopreservation. So what we have learned from ages, like from last few many years, especially these red carpet celebrities, what they are doing, कि वो अपने young age में अपने egg को retrieve कर लेती हैं. जैसे you know the celebrities, I don't want to name anyone. We all know Lara Datta and all those. We have heard so many things. कि वो अपने young age में अपने egg को retrieve करके freeze करवा लेती हैं. and then they procure their career and their life, and when they feel like now their time to settle down, have baby from their own eggs, so उन्हीं एग्स में अपने पार्टनर के स्पर्म, जिससे भी मैरिज होता है या पार्टनर होता है, उसके स्पर्म से एम्ब्रियो बना के अपना बच्चा करा लेते हैं. दिस इज वेरी नोन टू ऑल ऑफ अस. We are very much promoting fertility preservation even to young ambitious gynecologists, also to other branches, even engineers and those who are going into the professional world. Those who are deferring their fertility into the reproductive period, they can freeze their oocyte. But what the challenge was, we can now preserve the ovarian tissue itself. The beauty is ovarian tissue can be preserved, especially I'm talking about those adolescent girls. वो लड़कियां जिनका अभी पीरियड भी स्टार्ट नहीं हुआ है, अगर उनको कोई मैलिग्नेंसी या कैंसर हो जाता है, हम उनकी oocyte को हमको नहीं मिले तो हम ओवरी के टिश्यू को लेके प्रिजर्व कर लेते हैं. We just preserve the ovarian tissues now, and then with after preservation, that patient can go across whatever alternative therapy she wants for the cancer, malignancy, or any autoimmune disorder. And when things are better and now she is cured, we can reimplant this ovarian tissue inside the pelvis, and through hormonal stimulation, we can procure the oocyte later on. So this is such a wonderful and beautiful technology where the ovarian tissue can be preserved. Especially, it is a very boon, benefit and very blessings for those young girls before puberty or adolescent who are under anti-cancer drugs. जिसमें कि वो जो कि गोनेडोट्रोपिक टॉक्सिक ट्रीटमेंट लेते हैं या फिर हार्मोनली सेंसिटिव कैंसर है, where we cannot even stimulate them for oocyte retrieval. We just take the ovarian tissue outside. So the virginity is not hampered, the immaturity is also not an issue for the patient. We just take the ovarian tissue outside, freeze them. When the patients are cured for their disease, we again reimplant the same ovarian tissue and they can have their own andas and their bachas. There's a real life case history I want to discuss with one of a 28 years of female with a malignant breast cancers. As we know, breast cancers are also hormone dependent. So there, whatever chemotherapy and the gonadotoxic chemotherapy and radiotherapy are given, अगर हम उनको पहले से chemotherapy radiotherapy दे देंगे तो उनका अपना बच्चा नहीं हो पाएगा. So what we do, we just retrieve the ovarian cortex and cryopreserve them. उनको liquid nitrogen में हम लोग -70 degree पे preserve कर देते हैं. The patient now even the cancer treatment has become such a beautiful one. I have so many list of patients whom I have really done a fertility preservation and they have gone for a surgery and their chemotherapy radiotherapy and they have come back for their fertility eventually. And now they are coming. One of my cancer survivor patients has come for the second baby to me. So this is the era where we are living, where the cancer is no more like एक time था cancer हो गया मतलब उसका हम लोग तो oh no वो तो गया अब. गॉन आर द डेज. अब उनसे बहुत यंग लोग कहीं भी किसी कारण से भी चले भी जाएंगे, बट कैंसर सर्वाइवर्स आर रियल वॉरियर्स एंड they are holding the flag to make other people also learn how you should live your life with positivity. So they are so optimistic. They come to us. They get their sperms, their oocytes, their ovarian cortex preserved. They complete their treatment, and again come back to us to get their own baby. So this is a beauty of getting a this advancements of ovarian cortex preservation, where we just retrieve the ovarian tissue. The patient has undergone the chemoradiotherapy, which is obviously the gonadotoxic. So once the treatment was complete, we again transplanted the tissue into the pelvis. Then with the exogenous hormones, the oocyte were retrieved and the healthy boy which was born. So if I want to conclude, before concluding, there are few more points which I wanted to bring into the highlight. One is like going for, I'm sorry, this laser hatching. This laser hatching also one of the very recent trend where the embryos are hatched to make it more comfortably implanting into your endometrium lining. So is the advancement of this nanobot technology, where there is some AI with the advent of robotics. There is some robotic equipment which attach to the tail of the sperm, which are not motile, make them motile, and we can use that sperm for fertilization. And stem cell is ever evolving. There's so much researches are going on the stem cells. as far as my experience is concerned, I would say I've got some success in the stem cells. In the endometrium lining is concerned, yes, I can say that too when we judiciously put stem cells in the subendometrial plane through the pickup needle with a hysteroscopy. But in ovarian cortex, when the ovaries are dying and there is low AMH and the early ovarian failure, I don't think stem cells has given us that rewarding. It is under research, so I have not put it right now. So if I conclude, what actually we are doing is a PGD and the pre-genetic testing by which we can go for a proper embryo selection and getting to know which embryo to be transferred, and then we can go for this time-lapse technique, artificial intelligence, and then this cryopreservation, single embryo transfer. There's so many things which are coming into this field, and I think I am greatly looking forward for this artificial intelligence to give me something so that we can really increase our success rates to near 100, and definitely to make the comfort life of the patient also very comfortable and less painful if it at all they feel it painful. Though if I know my journey when we started doing till today, the convenience of getting an IVF treatment and is very comfortable. Patients are just coming for 10 to 12 days for us for the stimulation, that too also with the advent of this online consultation we are getting at their own places. They just need to visit us for 3 to 4 days and their work will be done through online consultations only. Many patients even abroad are getting stimulated outside this India, and they come back, they get their stimulation done, they get the retrieval done and transferred, and then they go back in the span of 5 to 7 days. So this is a beauty of this advancement in technology which is becoming into the line of IVF, which is real passion for me. So, Jigna, I would like to conclude my great thankfulness for you to provide me this platform to share.
Yeah. Thank you so much, ma'am. You gave such a valuable insights. So, ma'am, just I have one question regarding you gave that which method are better and all. So, I want to just ask which method is the best among all this whatever you have mentioned.
Right. So, such a wonderful question you have asked, Jigna, because every time patient come to us, they also have the same query. कि जो कौन सा best technique है? So, I would answer this question that not one fits to all. The beauty of IVF treatment is that we have to customize treatment for every patient. And one more thing, it's not just every patient. We have to customize the treatment to even one patient in two different situations. One of my patient coming for treatment for one thing to one time to me, I've got something to offer this patient, and when the same patient comes later on, maybe the protocol and the advices will be different depending upon the current status of the patient. So this is very, there is no blanket treatment, there is no umbrella that yeah, what fits to one would fit to all. The treatment of IVF is very customized, and here in Bliss IVF and Gynecare, where I'm practicing and I'm doing my work, my patients appreciate this thing a lot. That, ma'am, the kind of time, the kind of concern we spend with patients to make them educate. Many of time, my patients are the one who tell me कि मैडम आप लाइनिंग अच्छी आप डाल देते हैं. So this level of confidence when comes through patients makes a lot of difference. So answer to your question would not be very straightforward. Every technology, every process has got its own pros and cons. They have got their own advantages to one. They may not be good for others, and they may not be good for the same patient at different times. So we have to spend some time with patients, getting knowing what actually they want, what is their need, what fits best to them at that pretty moment of time. Today only I am coming from one of my IVF conceived twin pregnancy delivered patients, and now they were asking me कि next time आप मेरा जब करोगे तो मेरे को सिंगल बेबी चाहिए. अभी तो ट्विन हो गया बिकॉज मुझे ट्विन चाहिए था, अगली बार मुझे सिंगल चाहिए. दे एडेड समथिंग मोर विच आई एम नॉट शेयरिंग यार कि नहीं मेरे को लड़का हो गया लड़की चाहिए, वो सब में हम नहीं पढ़ते हैं. दैट इज एब्सोल्युटली नॉट अ मैटर ऑफ डिस्कशन, बट डेफिनेटली नाउ पेशेंट्स आर आस्किंग अस इन अ वेरी कैपिटल अप्रोच कि पिछली बार मुझे दो चाहिए था तो दो मिल गया, अगली बार मुझे एक चाहिए. That is how patients are utilizing and using us.
Okay, okay. Thank you, ma'am. Thank you, ma'am. So I would like to end the session. like we don't have questions, you can connect with us on LinkedIn. The If you have any queries related it, we can connect with on LinkedIn, and we will get back to your queries on with particular solution with consultation with ma'am. So I would end this session by thanking ma'am. I would once again extend a heartful thank to Dr. Sonali Gupta for this enlightening session, and your dedication to advancing the field of IVF is truly commendable, and your willingness to share the knowledge and the experience is very greatly appreciated, ma'am. And we look forward for continued growth in the advancement in this field. So thank
Thank
you
you so
so
much,
much, ma'am,
Jitna.
for
It
the
was a pleasure. It was a
yeah.
pleasure, was mine and a privilege to be with you. And I would like to thank all my fellow gynecologists who are there virtually with me. You can come across any query you have. You can put in the LinkedIn, or you can always WhatsApp me, or and you can connect to me in the Connect to Clinic website. Thank you so much.
Yeah, thank you so much, ma'am. Have a wonderful evening.
Thank you so much. Bye bye.
Yeah.